Thanks, Cliff. Can you still hear us, Cliff?
Yes, I can.
Okay, terrific. So while the slides are loading up, I'll just mention that I'm really honored to be here, very pleased that the forum is having this workshop and including health literacy, and really grateful for the committee who collaborated to develop this workshop, and particularly to Patricia Cuff and her team, some of whom I've met, Bridget and Megan, who just have obviously done a spectacular job putting this all together. And I hope I don't bring it all to a screeching halt over the next few minutes here. All right. So if you want to maybe go to the first slide, if that's doable. There we go. Terrific. No, keep going, and one more up. One more up. There we go. Okay. So here we are. We're at the beginning, a very good place to start. And go ahead to the next slide, unless, am I able to do it from here? Thanks. Terrific. So with this slide, I want to take an opportunity to talk a little bit about the partnership model for Canyon Ranch Institute, which, as Andrew mentioned, is the nonprofit organization where I'm privileged to be executive director and a board member. Because there was a discussion earlier on partnerships in this very important field of health professional education, I want to mention that our approach at Canyon Ranch Institute goes across all of the health and wellness disciplines and the disciplines that are concerned about and working in social determinants of health. So that ranges across the world in terms of our partnerships being with health delivery organizations, a lot of which I'll talk about in a moment, as well as with universities, with community centers, with schools ranging from elementary to high school, and also with large corporations, so multinational corporations, Fortune 500, Fortune 100 companies. And in working with them, our basic tenet is that we are all going to be in an equitable partnership in which everybody brings their very best. And that may be that they're bringing the intellectual property, it may be that they're bringing the financial support, it may be that they're bringing connections with the community, many other strengths that they may be bringing, or all of the above that I've just mentioned and others. So everything that we do with Canyon Ranch Institute is involved in health literacy. Health literacy is the currency for all of our partnerships, programs, and projects. And the integrative health model, so mind, body, spirit, emotion, and then everything is focused on prevention. So we work primarily very upstream. We do, and I'll talk about this in a moment, a lot of health professional education and training with individuals who are training to become health professionals, and some who've been health professionals for years or even decades, but it's always in this upstream model. So one of the opportunities that Andrew and I have had over the past couple of years serving as faculty members with the Ohio State University College of Nursing is to develop a brand new degree that is very much in keeping with what we've been talking about today, in that it is meant to meet the interests not only of our neighbors, friends, and community people who we call patients, but also the needs and interests of the healthcare delivery system and those individuals who wish to work in that system, but not necessarily in the more traditional models that we all have taught in and worked in terms of, as Cliff just so eloquently described for us, health literacy in medicine or health literacy in nursing. Nurses were, practicing health literacy before there was a term for it. And health literacy in all of the other professions, ranging from behavioral health to the counseling services and behavioral health to spirituality and so on. So this degree, which has been approved through all the multi-levels at Ohio State University, and begins this coming fall for people who wish to enroll in a Bachelor of Science in Health and Wellness Innovation. And it will also be becoming a master's degree as well, an MS in coming years. So as you can see, it's focused on integrative health, prevention, health literacy, health coaching, all under this rubric of innovation, all under this idea that quite frankly, particularly here in the United States, under the Affordable Care Act, there are a lot of requirements for companies and municipalities, government agencies, to have people on staff who are leading the wellness focus, who are innovating in wellness, who are helping those organizations to improve their health outcomes through wellness activities. So that's why this degree is, quite frankly, a word that we don't use in academia much, I guess, but marketable. That is why people are signing up for this degree, because they want to be a wellness director, a wellness coordinator, a wellness manager inside of these big settings that under the ACA are going to be focusing on having those sorts of professions at hand. So we can talk more about this in the Q&A if you're interested, but hopefully I've left the slide up here long enough for you to see that the learning goals are very much what have been discussed today. There's some in here, Liza, about resilience. There's some in, Andrew, of course, helped develop this, so we've got the scientific foundations. You're not going to graduate without understanding the science of health. There's also a focus on organizational transformation. So that's what we're talking about in terms of the healthcare system, and what it seems like everybody in this room has either said once or, is thinking about, I suppose. And that is that right now what we're doing is training people, learners, to work in a system that really doesn't exist much anymore and sure isn't going to be around in 10 years. And so that takes me to the second of the three examples that I'm going to share today, and that is the Canyon Ranch Institute Life Enhancement Program. So this program has been in existence for about 8 years across the United States. Canyon Ranch Institute partners with healthcare delivery organizations ranging from lots of federally qualified health centers to small rural hospital to very large health systems and very large hospital systems, as well as clinics. And the facilities that we make sure that they have are listed up here in the way of classrooms and places for people to engage in fitness. But the really important part is not so much the facility, although that matters, and we have big conversations about how do we start with what we have and then expand the physical space. And we have expanded with our partners in numerous ways, for example, to build teaching kitchens, to build fitness centers, to build yoga spaces, to build gardens. But really where it's at is the first two bullets there, and that they serve a low-income population, and that they are deeply and intrinsically connected to the community, and that they're thinking about that connection not only in terms of treating their patients after they get sick, or even providing the preventive services that we know are very important, but rather they're thinking way outside the box, way outside the walls, in that they're thinking about how do they help their patient community address jobs and address food shortage and address all these things that we've been talking about, as was beautifully discussed earlier with the social determinants of health. And I'm so glad somebody talked about that, because I don't have to go through social determinants. It's great being a little bit later in the day. We're all on the same page. So the 7 core elements of the Life Enhancement Program you can see up here are a lot of what we've been talking about today. I think perhaps those that maybe haven't been touched on as much in terms of ensuring that these health professionals are also brought into the integrative health model, brought into as they're in their first training, their degree-oriented training, and then also in continuing education, that they are working in ways that will help them to improve health through looking at health outcomes. We haven't talked as much, I don't think, about what you see there in 5 and 6, sense of purpose and spirituality. And this, a lot of it gets to working with a kind of health professional we haven't mentioned as much, and that is people who are helping in places of worship. So they may be mullahs, they may be pastors, they may be rabbis, they may be lay ministers. So a lot of what we do with the other health professionals, whether they're counselors, psychologists, physicians, nurses, registered dietitians, licensed clinical social workers, physical activity and fitness experts, and so on, is to help them bring in that aspect of the sense of purpose and spirituality that not everybody gets from an interaction with a oriented and designated spirituality professional. Many people also find that in nature, they find it in family, they find it, sense of purpose comes from work, from many other things. But we bring that in, that profession in. And so I bring it up today as so many of you are working in training people to be part of the new healthcare team. Think about, if you will, if you're not already, which probably you are, you just haven't mentioned it yet. So I mention it just to make sure it gets in the record, I suppose, the spirituality and sense of purpose professionals. So the core team whom we train are credentialed in the various areas that they bring to bear, including pharmacology, which I haven't mentioned yet, and community health workers. A lot of people who would identify as promotoras or diabetes educators, or people who work in the community who know the community and are in touch with them. The components are listed up here in that people who experience the program will go through 40 hours of group sessions and then 4 one-on-one consultations at the minimum, and those are the 4 that are listed there. By having 1 hour with each of these health professionals, they quadruple what the average American receives in terms of time with a health professional in a given year. So right from the outset of being in this 12-week program, they're going to quadruple that interaction. The program training for these health professionals is 90 hours per health professional. They first come to us at Canyon Ranch Institute. They focus on themselves. They go through the program in 1 week that they are going to deliver in 12 weeks. And then we come to them, and in 1 week we provide a practicum. It's a bridge from their previous training and career experience and what they've experienced at Canyon Ranch Institute with hearing all of the trainings that they're going to give and that they're receiving a curriculum for, an evaluation toolkit for, and they learn how to give the program. And they also go through a simulated participant experience. We don't call it simulated patient, but rather participant, in that they have the experience of sitting down with a participant who is a community member and also gives feedback after the simulation about how each of these professionals did. A big part of that simulated participant experience that the health professionals learn from is the handoff from the behavioral health person to the nutritionist, or from the behavioral health person to the exercise expert. They choose who they're going to hand off next based on the needs as they assess them of the simulated participant. So the content, as you can see up there, I've touched on a little bit. A lot of it is about building team, and it's about building that not only understanding of what their colleague in the other discipline or health profession does, but also learning how to support that person when that person becomes run down, when that person gets frustrated. How do they help to raise them back up so that they can be there for the patient community? The outcomes you can see up here are the sort of outcomes that when we share them, they get us invited to write journal articles, and they get us invited to go speak at conferences and serve on faculties, and they're really great, and we're very, very pleased that this is what happens with the patient participants. More than anything, however, what we're able to do is the top outcome you see there, that we're able to make that change, because that's really about the change in getting these best practices in health literacy that Andrew spoke about into the care systems and into the infrastructure. And once that happens, they're all building on that themselves, and we don't have to keep coming back and reminding them. We visit them, we Skype with them, we email with them, we call them, we go over the curriculum again and again as they go through group after group after group, and we never end the partnership. that's a specific of how we operate. Is it's not about a 3-year grant or a this or that or send each other reports. We're connected forever, and then what happens is things expand. As you can see from this slide, the effect in terms of finances is also very impressive. We use a lot of different scoring, as we talked about just on the previous slide, but the change in QALYs is also something that we take a look at and that we're really pleased with, because obviously there has to be a way to make these changes and have them be sustainable, which we do also see. I'm going to talk also briefly about another program altogether. So separate the Ohio State University program I discussed and separate the Life Enhancement program, and now this is the Arts for Behavior Change program that we've been doing in Lima, Peru. And you'll see there that it is again about health literacy, it's about using the evidence base, and it's about theater. And by using theater, what we're able to do is bring people into a space that is allowing them to talk about things that they wouldn't necessarily talk about. So in particular, Dr. Campos, this is the work of Agua Sobral, and this initiated in Brazil, and we are very much in his debt. But Theater of the Oppressed is different. We've built on Theater of the Oppressed and created Theater for Health. The difference in Theater for Health is the healthcare professional, and it is this healthcare professional whom we train along with actors, along with scientists, to be in the community and to help find a solution to the community health problem that the community identifies. So this health professional is already an MD or a nurse or a public health professional, already a behavioral health professional, and they get trained in health literacy and in how to engage with community in a setting where they're up there being the guide on the side, where they're up there being the arbiter of the science, but not in a top-down way, in a way that is about working with the community. The objective health outcome in Lima had specifically to do with a microbiological outcome. We were looking at the two pathogens that caused the worst disease and death in particularly vulnerable members of the community, and those were E. coli and Listeria. After the program, there was a decrease of 34.4% of the households having had those pathogens present to having them not present at all, so absolutely zero. I'm running short on time, so I won't go through this slide, but you did hear from Andrew about the Calgary Charter model that Cliff and Andrew and other colleagues created some years ago. Everything we do at Canyon Ranch Institute does test that model, and as you can see from this slide and from other information we'd be happy to share with you, it does validate the model of health literacy as a theory for behavior change, leading to objective health outcomes. So on a closing note, since we're here talking about health professional education, a lot of us have talked about the community-based health professional education, and these are just the main things that we are seeing when you bring in health literacy into education for all of the health professionals occur. So everything I think that we've talked about already today, the one thing that's not up here that we've talked about a bit is lowering costs, which of course is key. So I'll hand it back to Andrew. Thank you very much.